Hello, everybody. Welcome. We have quite a large group today, so we would love to hear where everybody's coming in from. If you want to go ahead and put that in the chat, we would love to see where everybody's coming in from. We'll get started in a few minutes once we get everybody in from the waiting room. Go ahead and mute yourselves, get comfortable, and I will begin to share where everybody's from. It looks like we South Carolina, North Carolina, Atlanta, Maryland.
I saw
Go ahead and mute
Hawaii.
yourselves as you come in, so we can share where everybody's coming in from. Lots of Michigan, Flint, California, Muskegon, Las Vegas. Welcome. Oh my God, they're coming so fast. Georgia, Minnesota, Troy. Hi, Janet. Clinton Township, Fort Lauderdale. Bring us the sun, please. We've got the UP. Hello. Wonderful. Lots of Michigan people. Thanks for supporting us as always.
Anything else?
Go ahead and mute yourselves as you come in, get comfortable, and we will get started in just a few minutes. Are people not? We're getting there. We're gonna get everybody muted by the time we begin.
Where?
Battle Creek,
Oh, okay.
Carroll, Rochester, hello. Tennessee, very nice. MWINSTL. I assume that's St. Louis. Hello, Alabama. That is okay if your camera is broken. You are still welcome. Florida, Port Huron. Wow, we have people from everywhere. Iowa. Go, is it the Buckeyes? Go Buckeyes. Arkansas, Georgia. Wow. We have a few more to let in, so just another minute or two, and we will go ahead and get started. Go ahead and get comfortable, get your pen and paper so you can take notes. We are in for a treat today of an amazing presentation from our friend Dr. Pellack. Mississippi, Grand Rapids, Hawkeyes. I knew it was something. Lansing, amazing. Hello, everybody. Hi, Shirley. Thanks for being here. We'll give it just another second and we'll get started. Looks like everybody that's in here so far has given us where they are from. If you're just joining us, we'd love to hear where you are coming in from. Go ahead and put that in the chat, get comfy, and we'll get started in just another minute. More South Carolinas, Port Huron, Lansing, Atlanta, Georgia, Port Huron, Detroit, New York. I haven't seen in New York yet. Pontiac, Oregon. I mean, we are just across the whole United States of America today. Well, how beautiful. The one good thing that came from Zoom is it can bring us all together from across everywhere, which is really lovely. Georgia, Minnesota. Awesome. Rochester Hills. All right. Texas. Clarkston, hello. Hello from Troy, Port Huron, Holland. Hopefully everybody has a beautiful sunshiny day today. South Carolina. It's a little sunny. It's chilly, but it's sunny here in Michigan. I'll take it. I'll take the sun for as long as we can have it. Right? I see some nods. Yes, bring us the sun. That is definitely something that I am enjoying for another few days, probably. I think the sun and the gray is coming. No sunshine in Grand Rapids? I'm so sorry. Sunny in Tennessee, love it. Raining in Iowa. Raining in New York. Maryland, welcome from Maryland. 85 in Orlando, rub it in, Florida. It's always nice there. But enjoy that weather. It's probably like a cold front for you, only 85. All right. Well, welcome everybody. Courtney, quick, Skywood's Director of Business Development is going to introduce Foundations Recovery Network.
Hello, everybody. Wow, look at this fantastic group. I am so appreciative of you guys all taking some time out of your day to be with us today. We are so excited to have you here. If you notice that you are not muted, if you guys could just take a second for me and just make sure that you are muted, I would greatly appreciate that. Trying to make sure everybody is muted for us. Just so everybody knows, this presentation is being recorded and it will be available on our Foundations Recovery Network website within a week or so, with all of the resources that Dr. Pellack will present for us today. I am going to give you guys a brief overview of Foundations Recovery Network if you are not familiar with us. All right, Michelle, the floor is all yours. Thank you, everybody, for being here today, and I hope that you enjoyed Dr. Pellack's presentation.
All right. And for more information on any of our Foundations Recovery Network programs, please reach out to Courtney or myself, and we would be happy to provide that specific information for you. Welcome to our continuing education event. We are very pleased to be partnering with ASWB ACE to provide the continuing education credits for today. There are pretty specific requirements that you're probably mostly familiar with, but I will go over those. You must remain on our Zoom meeting for the entirety of the meeting. Your camera does not have to be on, but if you would like to be on, it is helpful so that we can see your beautiful shining faces. I will put the course evaluation in the chat box at the end of the presentation. The course evaluation is a Google document. It works best if you open it in Google Chrome. Once you complete the course evaluation, your certificate of attendance will be emailed directly to you. I'm going to say that one more time because this often is something that gets missed. At the end of the presentation, I will put the course evaluation link in the chat box. That is how you get your certificate. You must complete the course evaluation. Be very mindful of your email as you enter it into the Google form, because that is the email that your certificate will be sent to. So be very careful of your dots and your slashes and that sort of thing. If you work for an organization that has a large firewall system or safety system, it can be helpful to do on your own personal device or forward the link to your personal device and personal email in order to not have too many complications. If you have trouble, it is no problem. I will put my email in the chat and you can email me directly and I will get the link to you to complete, because we definitely want everybody to receive the certificate of attendance for today. Again, please stay on the entirety. Your Zoom link is personal to you. When everybody filled out their own registration information, the Zoom link actually is your attendance. So if you leave early, it will alert us and we will then know that you are not on the program in its entirety. But again, if you have any trouble, I will be here to help. Courtney is here to help. No worries. We got you. We will get you through this. I am now going to introduce Dr. Pellack. He has been the clinical director at Keystone since 2021. He has earned his doctorate from Indiana University, Bloomington. His dissertation focused on characteristics that predict patient program compliance for chronically homeless, mentally ill individuals, many of whom had issues with drug and/or alcohol abuse. While at IU, David did an extended practicum at the Kinsey Institute, where he worked with clients with a variety of sexual issues and received training on numerous treatment modalities. As a Kinsey intern, David also co-facilitated a weekly group for transgender individuals. David completed his internship at the Syracuse Veterans Administration Hospital, where he focused his training on traumatized veterans in hospice. David has over 15 years of experience working with traumatized children and their families in foster care and psychiatric community residences. He has been with the ECU since 2016 and was the assistant director for 5 years before becoming the director in 2021. David became EMDR trained and incorporates this into the intense trauma work done at Keystone. As director, David enjoys educating the public and professionals by providing trainings on addiction, trauma, and sexual compulsivity. David continues to utilize his clinical skills by having an open door policy with his clients, facilitating a variety of psychotherapy groups, and assisting clients with trauma through EMDR therapy. If you do have questions, we will encourage you to put those in the chat box. And Dr. Pellack will take pauses as he is able, or we will save some time at the end to answer all of your questions. With this many people, it will be very hard to unmute. So don't forget about your question. Just put it into the chat box and we will be sure to answer that hopefully at the end of the presentation. Without further ado, Dr. Pellack, the floor is yours.
Thank you. Thank you. Thank you, Foundations. Thank you, Courtney. Thank you, Michelle, for that beautiful introduction and for all the help you've given me so far, and for your wonderful service and for providing us one of your former directors. She was working with us for a bit, so thank you. So today we have 4 objectives. Understand development risk factors. Let me start sharing my screen. We're going to be talking about sexual addiction and trauma and how to identify it and how to treat it. We've got a lot to cover in an hour and a half. If you don't understand something that I've said, please make sure you let me know if you're not hearing what I'm saying. Please let me know or let Michelle or Courtney know right away, and I will hopefully change that. Let me see. So let's get on with the objectives. Goal is to understand development and risk factors for addiction with sexual addiction. We're going to explore how sexual addiction develops, including psychological, biological, and social influences. Recognize symptoms and warning signs, identify the common behavioral and emotional indicators of sexual addiction and related trauma. And trauma plays a big role. I would say 95, if not more, % of the people that come to us, our facility, have trauma. Explore the link to intimacy disorders. Patrick Carnes considers sexual addiction. Patrick Carnes is the big guru in sex addiction. He considers it an intimacy disorder, and we'll go into that a little bit later. Describe why sexual addiction is considered an intimacy disorder and its impact on relationships. We're going to, as I said, explore treatment options, review evidence-based treatment approaches, including therapy, support groups, and medical interventions. Sexual addiction is considered a process or behavioral addiction. So an example of other behavioral addictions, as you can see, is gaming. We have people that come here. I just worked with someone this morning who had a gaming addiction. Gambling, not uncommon for people to come to us with a gambling addiction. Exercise could be a process addiction. Work, we have a lot of people that either worked extra hours because they were avoiding their home life. They were they wanted to avoid people in general. It's a addiction of
I would say
intimacy, as I said, and also they tend to isolate. A lot of isolation. Food can also be a behavioral or process addiction. I believe it can also be a substance addiction. I know of people that have to watch what they eat. If they have sugar, carbohydrate, then all bets are off. So it's the substance. Substance addictions, alcohol, narcotics, not uncommon, especially with marijuana, for people to come to us with an addiction to that. ADHD medication, I'd say they're the big ones. We had somebody stealing their wives' medication. So a lot of people use it because A, I've stayed up all night searching the internet, or B, I get more of a thrill when I'm using ADHD medication and I'm acting out. And we'll get into that a little bit later also. How to identify, in quotes, someone with an addiction, especially with sexual addiction. There's a lot of isolation or unexplained absences. I'm staying late at work. We have a number of people who, they'll get invitations from friends. Hey, let's go out to dinner. we're all celebrating so and so's birthday. Let's go to a movie. And they start isolating. They stop going with friends. Sometimes it has a lot to do with self-esteem. They don't really want me there. Or a lot of times it's I've gotten so caught up in my addiction that I would rather just stay alone and look at pornography, go to a prostitute, um, chat with someone sexually. Also, in regards to self-esteem, a lot of the guys will talk about, and I'm talking about men, the guys that come to Keystone are all men. Excuse me. The self-esteem issue is about if people knew what I was doing, they wouldn't accept me. I feel like I'm two different people. How much longer can I, hide this from them? So the more they get into their addiction, and addiction is, cumulative, it intensifies. If so and so, I knew so and so was against pornography, if they knew that not only am I looking at pornography on a daily basis, but what I'm looking at in pornography, or that it's progressed to me going to massage parlor, whatever, what are they really going to think of me then? So they tend to, hide, isolate. A lot of lying. And for the most part, initially they might, wife, spouse, partners, friends might believe them, but then they start thinking, well, people are believing me, so I'll just keep lying. And they come up with some really crazy lies, and they think that people are believing them. We get into the importance of what type of lying. Is it blatant lying, where I'm just telling a complete lie, falsehood, lying by omission? Yes, I had to work late. And that very well might have been true, but I didn't have to work 2 hours late. I worked an hour late, and I stopped to see my affair partner. I stopped in an adult bookstore, whatever. Gaslighting. Gaslighting is horrible. We're going to get into that a little bit later. It's basically making the person feel as though they are wrong. They are imagining whatever trauma they're experiencing, and that in turn intensifies the trauma. Why do you keep telling me I keep leaving the room and listening to phone messages? I've done that maybe twice, and I told you that was work related. Why are you assuming that I'm having an affair? I think this is about you. And they put it on the other person. It's really harmful. I'm late. I'm late for work because, as I said, I was staying up all night, looking at pornography. We had one person that came here that would stay up all night looking at pornography and/or gaming, and he didn't have time to attend to his ADLs, to bathe, because that took time away from his. Well, actually, what he started saying is, well, I can't because then I'll be late for work. You could if you stopped engaging in your inappropriate behavior earlier, sooner. You definitely would have time to brush your teeth, bathe. But he would go for days without brushing teeth, bathing. So yeah, missing appointments, family, friends. As I said, living two lives. Some people borrow money, and then and they're lying about why they are borrowing it. I need it for rent. I want to buy my wife a gift. The big thing is inability to express emotional intimacy. I can't share deeply with you, or that's changed over time. You were always somebody that I could confide in, and yet now I don't feel comfortable doing that. You've isolated. You've gotten kind of colder. You're not paying as much attention to me. And what happened to our friendship, our relationship? The typical behavior that we see or we know of that people come to Keystone with or come to therapy with is pornography and/or masturbation. It increases with frequency, duration, and intensity. Intensity could be what I'm watching, how I'm watching it. Not uncommon for people to be, and please don't get frightened about this, not uncommon for people to watch pornography while they're driving. I don't know how they do it, but they're doing it. watching it at work, watching it on work computers, work phones, leaving work early to go to a massage parlor, prostitute. Dating apps, and I have the other dating apps in quotes. There's the, basically hookup apps. But, what we talk to the guys about is you're really abusing dating apps. They could be, have a really serve a really great function. However, if you are abusing them because you're only going on there to try to get women to, or men to send you photos and exchange photos, that's abusing what a really good app to help people who are dating. To help people to date to feel more comfortable, getting out there. Cam girls, giving women, hopefully they are over 18, but other thing we talk about is you never know how old these people are. In fact, depending on the state or the county, if someone in pornography is pretending to be or looks as though they are underage, that can be considered child sexual abuse material. We had a guy spend $50,000 in 3 months on cam girls, but they're paying attention to them. They feel as though they're helping them. They don't have money. It's really not true. I mean, a lot of the money that they get, they have to give up to the person running the site. Sexting with people they know at work, and that's sending sexual messages or photos, attending. Going to prostitutes, escorts, massage parlors, and we always, when guys do our assignments, we always have them we always make sure they distinguish between prostitutes, escorts, and massage parlors. There is a difference. Typically with the escorts, you have to make the appointment. You have to go online. They do a lot of, is this the person I want? A lot of our guys will say, well, my behavior is just impulsive. Well, it's not if you chose to turn on your computer, log on, go to these sites and spend all this time, looking for the perfect escort. Fantasy and objectification, multiple relationships, and that could be relationships with men, with women. Not uncommon for guys to if they're seeking a prostitute to go with someone who's a transsexual, having affairs, sexual and emotional. When I do a couples session with a wife spouse partner, often what I'll be asked is two questions. One, was this an emotional affair or a sexual affair? And typically, the wife spouse partner is more okay if it was sexual. Because, I can't compete with a man. I can't compete with somebody with a body like that or whatever. But if it's emotional, that really hurts. One night stands, voyeurism and exhibitionism. This includes people using cameras. We have a lot of guys who will put cameras in public restrooms, dressing rooms. And then we had one guy who put one in a dressing room and then actually came back because he went to the dressing room and it wasn't there. And he went to the main desk or whatever and asked for it back. And they knew it was a camera. And that's how he got caught. Strip bars, adult bookstores, or sex in public places, violent or dangerous sex such as auto asphyxiation, chat rooms, catfishing. We have a lot of guys who will create fake profiles, and it's interesting. They will create a female profile to try to, get other women, believe it or not, to, sometimes they feel as though if it's a woman, they'll understand and they'll exchange photos. If sometimes they'll pretend they're underage. A lot of catfishing, fake email accounts, And then they will just ghost the people. They'll just close up their account. They'll ask them for a photo, and then they won't send photos of themselves. Use of objects or fetishes with sex, use of force, um, drugs, or and the use of force, that can be maybe considered a fetish. We always make sure, was this consensual? A lot of guys have difficulty with what is consensual because they don't understand that some women might be feel more vulnerable. They might not feel as comfortable saying no. We'll talk about that a little bit later. Were they drunk? Were they intoxicated? Did you purposely get them intoxicated? And that's the use of drugs and alcohol. More typical behavior, and this is it's in bold because it's a big one. It's an important one with clients, employees, professionals, family members, and supervisors. They've lost jobs, and it keeps happening. Inappropriate touching, sometimes that is frauderism. They will touch somebody on a bus, make it feel like it was an accident. A lot of guys will have stolen clothes or personal items for sexual gratification from their girlfriend's roommate's room or whatever, a family member's room, posting videos, making her posting videos or photos, and then stalking. We have a lot of people that, well, it's okay. I just followed her. I didn't look in her room. But how might she have felt? How might she have felt knowing that you were following her in your car, or that she saw you walking past her house? Or how did he feel? Um, Sometimes we'll get people that have what we call sexual anorexia. I don't want anything to do with sex, possibly because of previous trauma. We'll help people with that. Um, but mostly it's, people that engage in sexual behavior and it's inappropriate for these reasons. These are some statistics. I'm not big with statistics because they change so frequently. For instance, it was just a couple of years ago when I was asking, the clients here, when is the average age that the kids, first see pornography online? And it was then 6 to 10, and now it's gone to, 8 to 10. Now it's, 6, 7. People think, wow, it's cool. Adults do it, so I want to do it. But so many people come here that have started looking at pornography on a regular basis since age 12, 10, and it just screws them up completely for future relationships. That is the only coping skill they know. So not uncommon for people to come from homes where they've been traumatized. This statistic, 81% had at least one addiction in their family. Chemical dependency. Again, we get people that have a history of chemical dependency. They've been in treatment or they abuse marijuana. Mostly it's marijuana or alcohol. And we encourage them, you got to get off everything. We're not as strict with smoking or vaping. Is it fair for them to give up everything? Another school of thought is yes, give up everything while they're here so they could learn appropriate coping skills. But nicotine, it's a tough one. 81% reported a history of sexual abuse or pressured sexual activity. Other types of diagnoses, co-occurring diagnoses, ADHD, major depressive disorder. We're fine if somebody comes in with ADHD. We just want to make sure they're on the right medication, the right dosage, and why are they doing that? One of my big questions is, what is your intent? Why am I on ADHD medication? Do you really need it? Suicidal ideation or behavior, that's something we really have to look at when the people come in prior to them coming in, and then when they come in. Sometimes it's very difficult when they come in and they're, opening up about all of the behavior. Like I said, they feel like two people. They've hidden this behavior, But then it gets to the point where it's not hidden anymore. Somebody found out, they come here for a reason, and they have to share all this information, and they feel terrible. They feel horrible about themselves. Our goal isn't to beat themselves up. It's to, or help them, or to beat them up by get it out, get it out, get it out. It's to get rid of the shame you're feeling about that, move on, take responsibility for your behavior, but move on. um,
There's some
so,
questions
John,
in the chat. Do you want to answer them or do you want us to hold off?
sure, sure.
Okay. We'll go over just a couple, if that's okay with you.
Certainly.
Okay.
Can you read a couple?
Yeah. I'm just trying to find the first one here real quick so I don't miss anything. How does the explosive growth of paying to talk to someone on dating sites who are really just catfishing often, older clients with flattery and sexual promises or suggestive pictures fit into this addiction? I have clients that spend $20,000 in a month talking to someone who shared their fairly graphic material, written and photographic, that was barely not porn. The client would become physically agitated if they couldn't talk to their new friend.
Right. So that's where I would, kind of try to look at what's going. Well, later I ask two big questions. I always ask them: what is this behavior giving me? What is it taking away? So is it giving me a sense of self-esteem, a sense of affirmation? When I go to a prostitute, I feel great. We had one guy here who said, yeah, when I go to get a massage, they're just lined up waiting to, they want to be the ones to give me a massage. And that feels really good. What does it take away? It takes away my anxiety, my anger, my depression. So it's doing this temporarily. So I would start by asking, what's really going on? Why? What do you get out of this? What purpose does it serve? And let's look at that. What is it that you really need? Well, I want companionship. I want somebody to say nice things about me. Hey, can you start by saying some nice things about you? Where did all this start? And, what about when friends say something nice to you? When you're in a healthy relationship? What prevents you from being in a healthy relationship? Why is it that you feel better when I get these photos? What is it that gives you? Well, it tells me that, I've got power, I've got control. Okay, and that's another issue that often comes up that we hear. I need a sense of power. That's why I had sex with these women when they were intoxicated. That's why for some of our guys, they try to meet up with women. And once they have someone that's willing to meet up with them, a man or a woman, that's all they need. They don't want to meet up with them. They just want to, feel as though they have the power to get somebody to like them, to influence someone like that. So if I'm understanding your question correctly, I would look at what's really going on there. What does it give me? What does it take away? And how can we get that in a healthy way?
Next one is some people enjoy strip bars or use of objects or fetishes. Is this sex addiction?
Again, that's a very, very, very good question. So something is an addiction if I can't stop doing it, if I need more and more of it, if I feel shame after I engage in it. If we, give statistics, 86 to 94% of the people in the sex industry would leave if they felt they had a viable option. Sex industry is, a wide term. A lot of people feel as though I don't have, I've been told by my family that I'm not good for anything. I've been sexually abused at a young age, and that's why I've been raped. I feel as though this is the only thing I'm good for. I never had appropriate nurturing when I was a child, and I grew up feeling like, well, this is the only thing I can do. That's more of a values, moral thing. Um, somebody wants to go and once in a while, that's up to them. If they're going on a regular basis, if they're spending tons of money, if they're, going to the champagne room or the back room and they're, get having sex and it's unprotected, if they're lying to their spouse, a big thing is lying. Why, if you have to lie about something, that usually means it's not appropriate. So fetishes, the difference between we're going to get into this later, but a fetish and kink, fetish is something that I cannot have an orgasm unless I'm engaging in this fetishistic behavior. So I'm staring at someone's feet. I'm using this object. It really is more about inanimate objects. So it could be just a foot. You're not with that person. So kink is like, yeah, I enjoy this sometime. Next week, I might change my mind about it. No one's necessarily being hurt. So, if you believe that no one's being hurt going to um, a strip club, that's up to you. If you're doing it every week, if you're drinking, if you're driving after you leave, if you're starting to, try to get a relationship going with one of the strippers, if you're avoiding your family, if you're spending all your money, if you're leaving work early, then I would say that's addiction. How do I feel afterwards? I don't feel good about it. What is it that I'm again looking for? Am I looking for just attention? How can I get that?
I'll give you one more and then I'll let you move on. What about looking at pictures of young girls in swimsuits? They are totally clothed, but has the potential for flagging. This is a hard patient to treat.
It is because why underage, and there is a different. I mean, there's no real proof that somebody that looks at what we call child sexual abuse material, CSAM, will then go on to necessarily have inappropriate sex with someone underage. Usually, that's people that are they're online, trying to hook up with them. Um, my concern is, where are you in your addiction? Why is it that this is, what we call your love map? What is it about these women that you find, girls that you find so attractive? Is it they're vulnerable? Is it, for some people that are attracted to
Oh,
children,
let me
it's
see if
I'm insecure. This is the only person that would, I was, emasculated by my parents, by my wife, spouse, partner in high school. And these are the only people I feel that will accept me. So I can groom them and, they'll like me. Maybe I don't even want to have sex with them, but I want them to like me. This is the only person I feel won't critique me when I'm having sex. They won't pick on the fact that I have a small penis. My body isn't, I don't have, a six pack. So sometimes they go to that. It would depend on how often are they looking at that. Why is that the only thing that will, turn them on? And what is it about that they find so intriguing? Why can't you, what is it? Am I afraid of, looking at people my own age? Or is it appropriate? And how much time am I spending? And where is it leading me? Does this lead me to want to look at children without clothes on?
All right, I'll let you proceed before we answer more questions.
Okay, fantastic. Thank you. There were fantastic questions. Um, so we have John Money's Love Map. Now, this is from the 1980s. We often talk to guys about what is your sexual template. This is what I'm interested. And when did it start? What might have started it? Money believed that between the ages of 5 and 8, that's when you really start developing your unique map. Your brain starts saying, "This is what I'm interested in." interested in dating, interested in, I mean, sexually, what stimulates me. Now, maybe not fully sexually, but that will continue, um, as you grow older, especially in your teens. Now, what happens is that sometimes people go off track, and these are the detours that we often see. As I said earlier, early exposure to pornography, inappropriate behavior or talk. My family was making fun of me. We had one guy whose grandmother insisted on, he was a teenager, 13, I think. And when he would, grandmother would come over, she would insist on bathing him. And she said inappropriate things. Like, and his parents had said, no, he can bathe himself. But she would insist on bathing him and commented on his penis size. And that just left him very, marred and angry. And he needed a sense of control in his relationships. Um, Spanking, bathing. Sometimes I'm doing this because I love you, and they might look at spanking as, well, this is a form of love. Or, maybe I enjoyed it a little bit. Maybe I, got an erection. When people are, sexually abused or raped, a lot of times, they feel bad. I had an erection. I ejaculated. I had an orgasm. Yes, there are two aspects, well, there are several aspects to a sexual encounter, but if we limit it to emotional and physical, I tell them, I can't hold your hand to a flame and expect you to not feel pain. You might not enjoy it. So emotionally, it might be terrible, especially since I'm forcing you to do this. But, the fact that, the body's got some, real sensitive areas. And if you enjoyed that, or it was physically pleasurable, then that's what happened. It's not that, you're to blame for being, abused. This is what happens. Sometimes men will come in and say, well, maybe I'm gay. We're not here to judge gay, straight, bisexual. Let's just help you cope with what you're feeling and your self-esteem, sense of self-worth, your idea, your love map. Um, as I said, reinforcement of inappropriate behavior, innocent self-soothing. This often happens as a young kid. I hear my parents screaming and yelling in the bedroom. They do that frequently. And I stuck my hand down my pants. My teddy bear, I rubbed my teddy bear next to me, and that felt really good. So I kept doing that because that's how I was able to get myself to fall asleep, self-soothing. So it was rubbing something against me, or I learned how good it feels to, keep my hands down my pants. I eventually got an erection. I eventually learned about masturbating. And this was the only coping skill that I knew I had. So if I had a bad day at school, I would masturbate. Then I learned about pornography, and, I was off to the races. Someone being inappropriate, somebody physically, a parent. There's a good book called When He's Married to Mom. If a if a mother, of course, blame it on the mother. If a mother is smothering, using her child as a replacement for the father, taking him, we had somebody, you're my little man, you're my date for weddings. If they're inappropriate, it creates an inappropriate boundary, or inappropriate in a relationship between the mother and the triad, the mother, the father, and the child. And they don't know where the boundaries are. So a lot of times when they, start to date or leave home, maybe the mother saying, oh, you're going to go on a date, but what about me? Or they're married and the parents saying, when are you coming over for dinner? Why can't you come by myself? Why can't you fix my microwave, my whatever? And it's taking them away from the wife. So you're married to mom. She's the primary person in your life. You haven't been able to set healthy boundaries. Being groomed often happens. At one point, we had three guys who were They had an area in their vicinity when they were young, and their parents, said, go away, just, play outside. And there were guys in there that groomed them, each person. The person was showing them love, was showing them attention, or what they thought was love. And it became, totally inappropriate, but they weren't getting that at home. Um, Patrick, as I said, Patrick Carnes calls it an intimacy disorder. I might be able to have sex 5 times a day, 5 different people, but don't ask me to tell you I love you. Don't ask me for my phone number, and I'm going to ghost you if I do indeed give you my correct email address. A lot of fear of rejection. They had that in high school, junior high. It gives instant gratification. You always have the tools with you. As I said, people will do this at work, in the bathroom, while driving. I feel a sense of control over, my wife has had 6 kids, and, things aren't what they used to be. Um, a lot of times, especially with men, there's a sense of entitlement, justification, or rationalization. We really try to nip that in the bud. There's even this one test that we give, there's an entitlement score, and there's 30 questions that kind of help them understand, am I engaging in sex for reasons of entitlement? Do I feel entitled? I guess actually is the best way to say it. Do I feel entitled to engage in this sexual behavior that's inappropriate? Going to a prostitute, masturbating when I have a bad day. Why aren't you going to your wife, spouse, partner, friend, talking about it, as opposed to using sex just as a means to calm down? Yeah, we talk about how sex is a byproduct of a healthy, long-term, stable relationship, or it's used to enhance a long-term, stable relationship. Some people have poor social skills. It could depend on upbringing. Excuse me, upbringing. A lot of guys grew up in a home where sex wasn't discussed at all, or they were told that. We had one guy, his mother, I hate using the word caught, but caught him masturbating, and I think he was 15. And his mother said, "This is where Jeffrey Dahmer. This is how Jeffrey Dahmer started." So if masturbating is wrong, bad, then screw it. I might as well just be having sex, or I might as well be looking at pornography or whatever. These are my 2 big questions. We talked about this a little while ago. What does this behavior, activity, substance give me? What does it take away? And when I say take away, not, a lot of guys will initially answer, it takes away time from my family, yada, yada, yada. No, it takes away my anxiety, my negative self-esteem. So if we're starting an intake, it's always best to try to, look at not what is wrong with me, but what happened to me. As I said, 95% of the people that come for treatment have been abused, have trauma. We take a trauma-informed care approach. These are the assessments that we give. I think if you just type in sex addiction questionnaire, SLAA, Sex and Love Addicts Anonymous, has a 40-question self-diagnosis questionnaire, answering questions, kind of the ones that I've already brought up. Do I feel guilty after I've engaged in this behavior? Do I lie about my behavior? Do I need more of this behavior in terms of intensity, time, duration, in order to get the desired effect that I wanted? Yeah, am I lying about it? Am I hiding it? Yeah, questions like that. Have I tried to stop but have been unsuccessful? We do, because we're certified sex addiction therapists and have been trained, we have access to a what they call the sexual SDI, sexual dependency inventory. And that's a 360 question assessment. It'll look at what behavior I'm thinking about and what behavior I've actually engaged in, and it will weigh them. So it won't just ask, do you engage in this behavior, but the frequency. Um, or, when I'm thinking about it, what's the intensity? How much control does it have over me? We always talk to people about mandated reporting because we are mandated reporters. So we want to make sure that they know that, hey, if you report and this hasn't been reported already to police, to a lawyer, that you've engaged in something illegal, we will be forced to report that. It's not a good way to start an intake, but we always want to make sure that they don't feel hoodwinked. We want them to know that right away. We also, oftentimes, when they're doing an intake, for us at least, that might be why they're coming. Um, we often ask about trauma. Sometimes this is a good way to get into the sexual history, what they're engaging in, because they'll talk about, yeah, I was, raped as a child, or yeah, my father was inappropriate. My father, left Playboys around, and yeah, it's something that I've started doing more often. So I guess yeah, that was traumatic. Or my father would ask me inappropriate questions. Um, we often ask, what do friends think? What are friends' perspective on your behavior? Yeah, they've noticed a change, and it was friends that of mine that got me to come here. Or I've been, as I said, isolating. I don't engage in hobbies, or I do engage in hobbies. Well, what kind of hobbies? Well, I really like to, surf the internet. Okay, great. Well, what do you usually surf? I know nowadays, a lot of people are, looking up sexual stuff, or, is it gaming? Well, yeah, it's a little bit of both. Um, Sleep patterns, because a lot of people will, I wake up and what do? I go to the internet. Or no, I'm not sleeping well. What happens? Well, I'm usually on the internet. What are you usually looking at? Um, when we diagnose, we typically diagnose with impulse control disorder. The behavior is impulsive. A lot of times there's also a second or third diagnosis, anxiety, and it could be that they're using this to help with their anxiety, to help with depression. Antisocial personality disorder, we don't see that much, but that would be for people that, engage in, um, really harmful sexual behavior with others, people that have, raped, or borderline behavior. Sometimes we see that. I can't leave them. I need to be dating someone all the time. Obsessive compulsive personality disorder. We also look at their medication history. Interesting when guys, we ask, are you taking testosterone? And some guys will be very honest. Yeah, it helps me sexually. But it's helped you to the point where you now have a compulsive behavior. Very rarely will guys say, well, helped because I didn't have energy. I was depressed. Not uncommon for people to come here, and when we talk to them, there is some traumatic brain injury. They've had concussions. As a child, they were in a car accident. And usually these are the people that just can't get when we talk to them about why something is inappropriate, when we go over they have four major um, assignments to do. And sometimes they're just not getting the assignments. And then we start talking about that. Was there any kind of brain injury? Bipolar disorder, autism spectrum disorder, really, really sad. We're getting a lot of people that are on the spectrum. It's difficult. We will take people if it's rather mild, but there's such a need for people who are higher up on the spectrum to get help. They really just don't understand. This feels good. I'm not hurting anyone because it's online, but I can't stop doing it. And then, if they have a job, they're doing it at work. They're doing it all hours of the day. They start to, go on chat rooms, and it's all innocent, but it's very difficult to help them understand the inappropriateness of it or help them try to get something else, another activity that they enjoy. We talked about kink versus fetish, sexually emotional anorexia. I don't want to see anything that involves a vagina, a penis. I just don't like sex. Well, why? Well, I've had bad experiences. Well, what kind of bad experiences? People made fun of me. I don't feel masculine enough. Well, what does we do a lot of work on? Well, define masculine. It's not about penis size or being macho or, being, strong or in control or loud or anything like that. Um, yeah. So our goal is finding what the triggers are, and then working on shame reduction. So I'm going to skip right next to we want to make sure that we find what their triggers are, and they could be physical or emotional. Shame versus guilt, help them understand. We want them to leave without any shame about their behavior at all. Might sound a little crazy, but we don't want them, feeling shame about it and then carrying that shame because, as we'll see in a minute, that typically just makes the cycle continue. Guilt, yeah, maybe a little bit of guilt to remind them of how this felt. What we encourage them to do is play it forward. Think of how you felt in the past when you engaged in this behavior. Think of what happened when you engaged in this behavior in the past. Wife, spouse, partner found out. Your boss found out. You lost a job. So let's go with that as opposed to just guilting yourself. Empathy, empathy not just for the other people, but that's the focus is shame and empathy for your victims. It's also empathy for yourself. You engaged in this because, most of the time because there was trauma. And what are we going to do about that? How are we going to start being good to yourself? Some people don't realize that, it's okay to do fun things in your life. And there are fun things outside of, using a computer to look at pornography or waiting for the day when I get to, go to see, I've saved up enough money to see a prostitute or go to a massage parlor. If I could go over the cycle real quick, and then we could maybe do some more questions. So this is the offending cycle. Triggers, they have external, internal. External would be I see something that arouses me. I see a billboard. I see somebody walking down the street that meets my template. I smell a perfume or a cologne that reminds me of an affair partner, or it just feels good. Somebody rubbed up against me, and that reminds me of, my childhood. Internal would be I walk into the office today and my boss says, we need to talk about yesterday. I automatically think, oh gosh, I must have done a poor job. She hates me. I'm going to get fired. And I don't have the skills to really think about this. I don't use my cognitive behavioral approach well, what are the facts here? I just keep thinking it's me. It's my self-esteem. Reminds me of how my parents talked to me. You didn't get straight A's. You're good for nothing. I continue walking in the office or whatever, and someone says, wow, nice tie. I assume they're making fun of me because that's what I'm used to. I was bullied as a child. And this continues throughout the day. I start feeling resentment or anger. I get home and I don't know, there's no mail, or I was expecting something in the mail that I didn't get. And, why me? Why me? I see more billboards. My wife, spouse, partner says, you're late. And I just cut them off and I screamed at them. Why is everyone picking on me? Why are you always picking on me? I didn't let them finish. What they were about to say was, is everything okay? I was worried. So what do? I don't have good coping skills. The only coping skills I know are looking at pornography, going to an adult bookstore, trying to hook up with someone, going to a prostitute. So I start that behavior. And it's the cycle. The cycle could be one day, it could be a week, it could be a month. As long as I know I have a prostitute at the end of the month to look forward to, I could, get over whatever my boss is saying to me, what people are saying to me, because I know I have something to look forward to. I know at the end of the day I can eat. I can engage in sexual behavior, and no one's going to see me or stop me. But typically, what happens is I feel okay. I feel better afterwards. The anger's gone, but I haven't learned a coping skill. So I still have to face my boss tomorrow. I still have to face those billboards tomorrow, and then the shame and guilt kick in again. So, do we want to take a couple minutes for questions?
We do have a lot.
Oh,
There are so many questions. It's such an interesting presentation. Thank you so much for your knowledge. Um, I
it
think
was
that
passed
I'm
on
going
to me
to,
by many people.
I
So
mean,
that's why
I
I
can tell.
appreciate passing it on to others.
Yeah. Um, I think I'm going to try to ask some of the general questions as opposed to
Sure.
the case scenarios. And then if we have time at the end, we can review some of the case scenarios. Um,
Okay.
the first question is, what are the biggest, if any, misconceptions you see about professionals having about sexual addiction?
I think some of them these are people that are, they're kind of sick, they're perverted. It's really, I mean, I'm talking in extremes. It's really sad because even within the 12-step, there's a hierarchy. So, typically people with alcoholism, they're kind of at the top of the ladder. Good for you. You fought alcoholism. But what I find is that people with eating disorders, they overeat, Overeaters Anonymous, or people in 12-step groups for sex, they're perverts. They have hurt people. They go after children. They're really bottom of the barrel.
Mhm.
I had somebody tell me that when they went to they had a long goatee. Their head was shaved. They had a tattoo on the back of their head, tattoos all over the place. When they went to their first SLAA meeting, the group, when he walked in the room, the group said, "Oh, I think you want the AA meeting down the hall." And it's because of what he looked like. So I think people just have this misunderstanding. It can be anyone, and there are people that need help. I always say there's no one at the age of 5, at the age of 18 that says, wow, I can't wait for the day when my children won't talk to me. My wife wants a divorce. I've paid all this money in court legal fees. I've lost my job. My name is in the newspaper. Or here I am in my basement and I'm looking at pornography all day. I don't have any interest. I have such horrible self-esteem. I don't try to make friends. So these are people that need help. And
Mhm.
once you break through that, you're open to them. They're usually very open about talking about it, talking about the trauma. They're hurt people.
Wonderful. Thank you.
And another question.
Yeah, another question is, it was mentioned that some clients may not know or understand their behavior is inappropriate, specific like excessive masturbation. Do people tend to self-identify their addiction, or does it typically have to be identified for them?
Very, very, very good question. We will help them with their behavior. They have to do 4 assignments. One is a life story. Next one, you look at themes in your life story and you create an inventory of offending, compulsive, and or deviant behavior. Once you make that list, you present it in front of the group, get feedback. You then look at that list or who was victimized. You make a list of victims. You share, this is what I did. This is how they were victimized. Then the 4th assignment is statements of responsibility. I take responsibility for having hurt this person. And by doing this, this, and this is how I hurt them. I take responsibility. They are not responsible. And I am responsible for not engaging in this behavior by doing X, Y, and Z, going to meetings, going to therapy. In these groups, they get feedback from other people. And the goal isn't to beat the speaker or presenter up, it's to help them get it all out. I look at it as mold. If you're keeping any of these a secret, A, why do you have to keep it a secret? B, it's going to come back, and you're likely to think, I never shared that. I can do this again. I can do this. So the goal is, some people don't realize they've hurt people by ghosting them because they've grown up in an environment where they weren't nurtured. Big boys don't cry. I'll give you something to cry about. I don't want to hear it. Or not uncommon for, dad was, acting out in some way. Mom was really depressed. She couldn't be present. So they didn't learn these things. Sometimes I want revenge. I was hurt as a child. I'm still that 7-year-old child inside, and I'm going to hurt somebody else. I was hurt. Why can't I hurt you? Sometimes that happens. But yeah, we always, did you think about the fact, we call it the ripple effect. Did you think about the fact that when you were leaving work early, that not only did, you hurt you, but you were in danger of losing your job? How would your family have felt? How might they have been affected? It's likely that other people, you work with had to pick up your slack. It's likely that maybe the company lost revenue or whatever because you weren't working to your potential. When you had the affair with the person at work, how do you think other people saw that? How did they react? Did they feel slighted? Did they feel like you were given special treatment? So we help them with this. Again, it's not to beat them up. It's to help them understand this is, this is where your addiction has led you and its effect on other people.
Um, you sent over something? Yeah, I sent over what you sent me in regards to the possible.
Sorry about that. All right, we'll do one more and then you'll have about 20 minutes to
finish up.
Finish up. Are there studies that identify in some sexual desires? Are there some studies that identify that in some sexual desires are associated with the experience of being sexually abused, such as a female who no longer is interested in men sexually, or a male who finds the inappropriate pleasure from being raped young, preferencing men as adults?
Yeah, there is a lot. It's called trauma reenactment, re-traumatizing. So the person will re-engage in the same type of behavior that they engaged in, when the negative experience happened. That's why a lot, with the people that are sex workers, it's not uncommon for them to have been mistreated, and they feel like, yeah, this is fine. This is what I'm used to. So it's trauma reenactment. And we, tell the guys, you lied to your wife once, she caught you, or partner. You said you'd never do it again. Then you did it again. This is, re-traumatizing her or him. But it's not uncommon for people. That's why, things like BDSM, is it really, this is what I enjoy, or is this what I feel as though I deserve? This is what I associate with love. I was told, by my father who was raping me, by the person who raped me that, oh, you're really good at this. This is all you are good for, or, oh, I love you so much. So they associate that and they'll engage in that behavior. Okay, I'm going to continue.
All right.
Okay. Oops. So some things we have to consider definitely are homicidal ideation, substance abuse. A lot of guys will downplay what they've done, and when they come in, it's wow. Expense. It's not cheap to go to an inpatient facility, especially if they don't take insurance. And a lot of places will not, a lot of insurance companies will not cover sex addiction. You have to kind of, mask it as something else or focus the treatment on something else. There's a lot of time commitment and it's emotionally intense. If you're really doing treatment, well, it is really, really intense. We always, if there's legal issues, get legal representation right away. We make sure our guys are treated for STIs. And part of that is so that they know, because a lot of them won't get tested. Or, yeah, I was tested 5 years ago. Not uncommon for people to not use protection. And they'll say, yes, I didn't use protection, and this was offensive because I could have given the other person an STI. I say, what about pregnancy? They could have gotten pregnant. We test everyone here for STIs. Disclosure is really tough. We do not do disclosure with the wife, spouse, partner here. I'm not going to do it. I don't think it's appropriate to do disclosure. And disclosure is having the person say everything that they've done sexually that was inappropriate. There's three types: staggered, forced, and therapeutic. Forced is, I'm on the news that I had an affair. Forced is my wife sees a text from someone that says, oh, I love you so much. Can't wait to see you tonight at the hotel, whatever. Staggered is the worst for the partner. It's when you say, oh, you caught me. Yes, I was looking at pornography. Promise, this is it. This is the first time I did it. I won't do it again. And then what the person learns is they don't learn that, yes, my wife, spouse, partner doesn't like it and I shouldn't do it. I just have to learn how not to get caught. I have to make sure I erase my history. But then they get caught again. And then they get caught doing something else. And that's worse. I start to develop trust in you, but then I find you're acting out again. I told you I don't like you looking at pornography, and yet you did it anyway. Because sometimes guys will say, well, my wife allowed me to, my wife, spouse, partner. Did they really allow you to, or were they concerned that if they don't, you're going to do it anyway? And then that's going to be like a double betrayal. Not only did you do it behind my back, I told you how much it affects me and I'm offended by it, and you still did it. So sometimes, a wife, spouse, partner will kind of just give in. And well, you didn't tell me I couldn't look at it 5 days a week. You didn't tell me I couldn't look at this. And also, if there's an addiction, it's going to lead to other things. Therapeutic is when, the husband, wife, partner, whatever, says, I want to know your entire sexual history from early ages on. I want to know your sexual history from the time we started dating, or I want to know your sexual history from the time we were married or started really, we were committed. And they have to list everything, and they do it. The wife, spouse, partner has a therapist, hopefully a certified sex addiction therapist. And they go over it together, and the wife, spouse, partner has a chance. Sometimes it's read with the therapist beforehand with the partner, and then that allows them time to develop questions. So treatment considerations, if someone's just saying, yeah, I think I just got caught, I don't know if I could afford treatment, I will encourage them to go to 12-step meetings. We always encourage 90 meetings in 90 days. That's Sexaholics Anonymous, Sex Addicts Anonymous, Sex and Love Addicts Anonymous, Sexual Compulsives Anonymous. It might also be going to Adult Children of Alcoholics, AA. They might need AA also. We had a guy from North Dakota, and very, very, very few S-related 90 or 12-step meetings. So they had to go to an AA meeting, and they were encouraged not to say, hi, my name is so-and-so and I'm a sex addict, but to say, hi, I'm an addict. I'm a cross-addicted addict. Yeah. There's a little bit of difference between the Sexaholics Anonymous and the other. Sexaholics Anonymous create what they call your bottom lines for you. So you are not, if you're going to their meetings, they really want you to not be having any type of sex unless it's within a marriage, um, and you're having sex with the person you're married to. Sex Addicts Anonymous, you're allowed to create your own bottom lines. I will not have sex outside my marriage. I will not look at pornography. Um, we encourage them to do work the 12 steps, get a sponsor, develop a strong social network. These are three things that guys will often forget. They'll go to meetings, but they're not honest. They're not open-minded about being receptive to ideas. And finally, they're not willing to do what it takes. And so they might say, yeah, I'm ready for treatment. Yeah, I want to nip this in the bud while it's, not so bad. Are they really willing to do what it takes? And you have to help them with that sometimes. Yeah, you are going to have to go to 90 meetings. What if you are on kidney dialysis? This is, can be considered a disease. I also encourage them, don't say, I have to do this. Say, I want to do this. I want to go to a meeting tonight, even though it's, 30 degrees and snowing. And I want this because I want recovery. And this is the way I get it. Um, yeah, we don't help people, determine what is normal for them or healthy. We just say we help them to stop the addictive behavior, get rid of the need for the dopamine rush and be okay with healthy, regular monogamous sex. I don't need to be doing this. I'm happy when I'm with that person. They accept me. They know everything about me. I don't have to worry about, them putting me down because I'm open when I feel as though I'm put down. I've learned to use what we call the feedback loop, and I'm ready to be in a healthy, open relationship. I also can face them because I know that I'm honest with them. I'm not having sex outside our marriage. We encourage individual therapy, again, with a certified sex addiction therapist, if one is available. We might encourage them to go continue with group. Our guys always say, hey, group therapy is what helped me the most. And we do a lot of groups, 2 groups a day. The group I do on Wednesdays is almost 3 hours a day. Actually, sometimes it's over 3 hours. I don't like this term. Some of the guys way back were calling it Bloody Wednesday because, this is where they share and I nip that in the bud. We're not going to call this Bloody Wednesday. This is your chance to come clean about all your behavior, and we're here to help you, to support you. You're not alone. I always tell them that the guys here might know more about you than any other person in your life, and yet they might not even know your last name. Sometimes we encourage them to go to an offender-specific group, depending on the state that they come from. Tennessee, Pennsylvania have mandatory, if you've done something, illegal, oftentimes you have to go to their groups. And from what I hear, the Pennsylvania groups are more degrading, belittling than they are helpful. Certified sex addiction therapists, I've gone through basically 4 weeks of intensive training. I have to, be recertified every 2 years. Different than a sex therapist. A sex therapist might help you, engage in sex and, enjoy sex more. But we're helping them with issues that, as it says, causes severe stress or progressive negative effects. Divorce, mislike of themselves and their behavior. Our goals are to decrease shame, increase empathy, not only for their victims, but primarily for their victims, but also for themselves. How can I ever forgive themselves? And we have guys that come in here kind of cocky. I didn't do anything wrong. And then guys come to my office crying. I can't believe I did this. How are they going to forgive me? I can't believe I will never forgive myself. And, what we have to do is, what good is it to hold on to it? Play the tape forward when you want to act out again, but it's not going to do you any good to continue beating yourself up over it. You've done that enough, or you've been beaten up enough. So we got to move on. Use your tools. Um, Scope of victims, breadth of negative consequences. So it's not only that they were a victim, but how did I victimize them? Yeah, I was having sex outside my marriage. What does that mean? How does that hurt them? Could have given them an STI, hurt their self-esteem. They don't have trust in you. Um, the other tough, or another tough thing I hear from white spouse partners is, I don't know what to do about this. I want to leave him, but I want to stay for the kids. Um, and what I often hear is, younger kids will blame the mother. How can you leave him? He needs help. Um, no, don't do that. Or the white spouse partner might need the support, whatever support they're getting, the financial support, or they can't do this on their own. Unfortunately, what might also happen is that a child might say, I can't believe you stayed with him, when they find out what happened and they know that the wife knew. I can't believe you stayed with them that long. What kind of role model are you for me? What you've taught me is stand by my man no matter what. So it's really tough for the wife spouse partner. Not only are they betrayed, but then they have to often deal with kids, with parents. You better divorce him. I won't help you if you don't get a divorce. um, so we do all this through the feedback that guys give in group when somebody's presenting their life history, their inventory of offending, compulsive, and deviant behavior, victims lists, and statements of responsibility. We also do a lot with trauma. We have them write a grief and loss letter to someone, and it could be, I'm grieving over the loss of my grandfather because he was the only one that ever expressed unconditional love to me. I'm grieving over my addiction because it took hold of me, and as a result, um, I'm grieving over my addiction because it took everything away from me. I lost my wife, and I allowed this to happen. I knew it was wrong. I still allowed that to happen. Um, so these are the assignments that we have them present. We do a lot of trauma work. Trauma work comes through the grief and loss letters, coping skills. We have a grief and loss group every Tuesday. We talk about ACEs, adverse childhood experiences. We have somebody that does that on weekends in education. I'm trained in eye movement desensitization and reprocessing. I have a lot of success with that. I'm very cautious about doing that because um, we only have 6 weeks and they have a lot of work to do, just with individual therapy. And I don't want to open up a can of worms and then say, okay, goodbye. But I will do that. I at least do what I call the calm safe space. I help them identify a space where they're calm, that they can go to when they're feeling overwhelmed. We do something called the trauma egg. Marilyn Murray has a lot of wonder. She's got a book out called The Murray Method. A wonderful, wonderful, wonderful individual. And in the trauma egg, they have to draw their traumas using stick figures. And it really helps them to use both sides of the brain to get at what they did, and then they process it in group. What they did or what happened to them. Emphasize mindfulness, journaling, art. Some other things that we do. These are the other coping skills. And I think the next one is my last. I'm going to leave this and then I'll take questions. I love this quote. I know it's a banner at River Oaks. I've not been able to find the source of this, but we have this posted, framed in our lobby. And I think this is really significant, especially for therapists that are kind of like, yeah, I don't know if I could work with these people. And it takes somebody special. There's burnout where, at Keystone. Okay, so how about a couple of questions?
Okay. There are so many. Um, let me go back and find. Oh, is it possible to explain this disorder to a spouse, and how does one go about doing so?
It's a very good question because a lot of times the spouse might not be, I don't want to hear it. I'm the one who was victimized. I don't want to hear that they had trauma as a kid. Um, but what I tried to do is, well, there's a couple of good books, and I think they might be on the list I gave. Mending the Shattered Heart is a collection of um, techniques or whatever by Stephanie Carnes. That's a very good book. It's difficult. One thing you first want to do is acknowledge their trauma, acknowledge their betrayal. And, I know it's going to sound crazy, but it doesn't sound like they've been very happy with this either. So, if you know of trauma from childhood, you could introduce that. I don't know if you understand how much lying and how much shame he feels about this, if they do indeed feel shame. But that's a very good question. And a lot of times it takes time. A lot of times a wife, spouse, partner will want to know, please help me understand. But a lot of times they're also, I don't want to hear an excuse. That's an excuse. And when our guys say, "Oh, I'm learning everything about, I'm learning a lot about myself," and ACEs, we have to really be careful with the ACEs. I did this because no, you have to take responsibility. Maybe there was a reason why you were more likely to engage in this behavior, but you still have to take responsibility for it. Um, yeah, so it's a delicate, line you have to cross. It's always best to make sure you kind of align with the partner that yes, you have been betrayed, but gradually introduce, this is what addictions are like. This is what where they typically come from, and it's not your fault. There was nothing you could have done. He's got to take responsibility for it. Um, what else?
Um, I'm just going through. Um,
I just posted my email address. Please feel free to, if there's a lot of questions, so if we don't get to them, please feel free to um, email me questions.
what program do you recommend for becoming a sex therapist?
I recommend ITAP. So you go on the IITAP, International Institute for Trauma and Addiction Therapists, professionals. ITAP, IITAP.com. I think that's a really good one. Now, you can do an online, you could at least do the training for the certified sexual offender training. I did that. It's a lot of reading and it takes time. It was informative. But I think the best is the in-person work that you get with becoming a CSAT. It's a lot of treatment, not cheap, but it's amazing all that you learn.
Okay. And we can send that out as well. I did just share the course evaluation link in the chat box. For those of you that would like CEs, please be very mindful of when you enter your information that your email is correct. This is a Google form, so if you are unable to open it, copy it, and send it to yourself, open it in Chrome. That is your best way to make it work. If your organization blocks Google, which I know a lot do, a lot have pretty big safety firewalls, forward it to your personal email, just copy it and send it to a personal device. If that still does not work, please send me an email and I'll put my email in the chat box. And then I can send that to you separately to whatever email you prefer. Can you copy my email? If you, I'm not sure. The
Was that?
recording of the webinar will actually be on the Foundations Recovery Network website, probably in the next week or two. There's still lots of questions, so I'm going to try to go back and ask some of them. I gotta go back pretty far though. A couple of questions they did ask about, can process addiction also be part of like stock markets or day trading?
Oh, yes, 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 yes.
Hmm.
Um,
High
yeah,
stakes
now,
gambling.
yeah, because it's more. I want to be making
Hmm.
more. I can't stop thinking about it. And there's so many, I mean, we've had people that have come here and they're not looking at porn on their phones. They're looking at stocks and stuff. Their wife, spouse, partners, kids don't do it.
Hmm.
I want you to be present. And that's a difficult. Yeah. But again, if it's interfering with my activities of daily living, it's a problem.
Who would you or what would you treat first if it's a 28-year-old male sexually molested at age 9 was also on Adderall? What would you treat first? The Adderall addiction is the question, I believe, or the sex
Um,
addiction?
well, I was also actually thinking of the trauma or the addiction. Um, Now it's common to treat the addiction and trauma together. In the past, it was always treat the addiction first. I would look at what the medication is doing. Is it a high dose? Is it really necessary? Why are they on it? What are they like when they're not on it? Is it
There you go. All right.
thank you.
We have lots of, this was amazing. Dr. Pellack, thank you so much for your knowledge. I have lots of claps coming in.
Oh, good, good,
It
good.
truly is such an important topic that we really find it, not a lot of people will talk about it. So this is wonderful that you were able to share this with so many people. We had, I think, at our highest 340 people on our Zoom today. So thank you
Wow.
all for attending, taking time out of your day to support our efforts of providing free continuing education events to the entire United States of America. That is so amazing. So thank you all. If you have any trouble with your certificates, I will put my email in the chat box again. So feel free to email me and we can work out whatever troubles we have. But thank you so much again for attending. And we hope to see you at our next virtual event in 2026. So happy
I
holidays,
can say one more
everybody.
thing, and I promise I'll do it quick.
Please do. Please
You
do.
talked about people don't talk about sex, addiction, or
Hmm.
sex, and that's where it starts. We don't talk about it with our children. We don't talk about it in a healthy way. They find out about it on their own. So, talk to kids about sex. It's like suicide. Just because we talk about it doesn't mean that's going to make them have it. So, yeah, I'm going to
When
shut
is an
up now.
appropriate age to have that conversation?
It's always appropriate because you want to tell young kids, about don't let somebody touch a part of you that's covered with a bathing suit or a underwear. And there's an introduction to a book that the person wrote it. I love this quote. I'm not going to quote it, but it was the funny thing about sex addicts is touch any part of my body that should be covered by a bathing suit or underwear, but I am not going to talk to you in a healthy way. I'm not going to, tell you I love you or be emotionally open to you. But touch everything that's, it's crisscross wires. So
Hmm.
thank you, everyone. And please don't hesitate, but, pass on all that you learned here to other people. And again, thank you, Courtney and Michelle, for calming me
Oh, will
down.
you, Dr. Palick, will you re-add your email to the chat for us? Somebody asked for it.
Sure. Okie
I'm
doke.
getting lots of questions that if you don't have a license, if you don't have a license, you can just put like XX or you can just put a space in there with a 0 and leave it blank.